All right. Good afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Corinne, and I will be your moderator today. We are excited to welcome Dr. Lynne Thomas as our speaker today. She will be providing a review of the leading CAD/CAM blocks and cements currently available from Dentsply Sirona. Before we get started, we do have a few reminders for you. At any point during the webinar, if you have questions, please type them into the Q&A section of your control panel, and we will answer them live at the end. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by Dentsply Sirona. Dr. Thomas, welcome, and thanks for being with us.
All right, well, thank you, Corinne. Thank you very much for that nice introduction. I appreciate that, and I'm very honored to be able to be here for Henry Schein and talk about one of my favorite things, which is my CEREC and digital technology I have in our office. We have been using CEREC technology since 2004 and love it. It's great. So thank you again for hosting such an amazing event. And, you know, in this day and age, there are so many different materials to choose from, and really appreciate the opportunity to talk about materials because it is so valuable to what we're doing. So just a little bit of an outline for what we're planning on doing today. We're going to look through some of the new Dentsply Sirona CAD/CAM blocks that are available and talk a little bit about their fabrication, what's involved in their fabrication, and getting the optimal outcomes for those materials. We're going to also review some workflows, look at clinical applications and how we're going to cement it and what's going to give us the optimal result. And lastly, we're going to talk about cement options. Okay, so here's where we are today. We have so many different materials available. And when I began as a CEREC user, and that was with our red cam many, many moons ago, we had basically the feldspathic ceramics. Yeah, we had Vita Mark II. And that was great. I still have lots of those restorations out there, and they are just pumping along there. They're great. And then we also had Empress CAD. That's a very aesthetic lucite reinforced ceramic that's really pretty. So I definitely would recommend that you experiment with those guys a little bit. And then we also had a resin block that was the paradigm. But today we actually are going to talk about some of our higher strength ceramic blocks that we have available. We're going to talk about two different zirconia blocks, one that's going to be a full contour and the other is going to be a multi-translucent layered zirconia. And then we're also going to talk about a new high strength ceramic that is a lithium disilicate. So just a little bit of a word about, you know, why do we want to maybe consider having zirconia in our armamentarium, you know, or what's available for our patients? It's a very predictable material. Clinicians report did a 10-year study that involved 121 dentists, and they looked at over 1,050 aesthetic crowns, and 100% of them had absolutely no fractures when it came to the zirconia. And that's basically what makes zirconia very unique and desirable versus other, you know, crown materials. However, as a CEREC dentist, you want an assortment of different materials because, you know, there is not one formula for teeth. They come in different shapes, sizes, and translucencies. So it's always nice to have a couple of different types of blocks available to you when you're doing CEREC dentistry. So for today, we're going to look at Zirconia Plus. That's the successor to Zirconia, one of the first CEREC blocks of zirconia out there. And we're going to also look at the more translucent or aesthetic zirconia, which is the multi-layered zirconia MTL. And then we're going to finish up our lecture today with looking at a high strength ceramic called Tessera. That's one of the newest blocks out there for lithium disilicate. Yeah. So as I mentioned, the CEREC Zirconia block was actually introduced in 2016. It was one of the first CAD/CAM zirconia blocks. In 2021, Dentsply Sirona decided to upgrade it, and so they just titled it Zirconia Plus. And that's just to show you it's the successor to the original zirconia that they had put out there. One of the improvements that they did with this is they actually made a larger block size. So we'll look at that in a moment. So, you know, not only does it have increased size blocks, but it also has improved aesthetics. It's one of the full contour zirconia, so it has a very high strength. The shades are basically the same, all A shades, a couple of Bs and a few Cs and one D, D4. It's kind of interesting. I've not used that one yet. Same indications. You're going to use it for full contour crowns or bridges. You can do multi-pontic bridges with this material as long as it's long enough block. And you can do wet or dry milling. That's a very big feature with the zirconia block. Dry milling, of course, is preferred, and that's only with regards to speed. But if you do not have dry milling available to you, you can wet mill it. And we'll talk about what you need to take into consideration if you desire to do that. The CEREC 5.1.3 material pack is necessary, and sintering times are going to be based off of pre-sintered thickness, not shade, as the previous block was. So this is the new block. It's 44 millimeters long. And as you can see on the right photo, it fits right on that little Speedfire ceramic plate. So it's perfect for a 4-unit bridge. These are some of the prepping parameters that you want to take into consideration. 1 millimeter is preferred. However, it can go down to 0.7. Okay. So the Zirconia Plus block actually has that nice little QR code that you will use for the Primemill. That little QR code contains information from the manufacturer about the sintering times and, of course, milling. So what you would do is you would go ahead and press on the little plus, because you're going to be adding a block to your Primemill. You press that, and then you would hold it right up to the camera lens, and that QR code goes into the Primemill, and it will connect all the way over to your Speedfire. So everything is basically set up to go. Once you insert the block into the Primemill, because once it has that information, it will say, please put the block in. Then you can go ahead and go through the touch process. For the Primemill, the touch process takes like, I don't know, like a minute, which can be a really long time when you're waiting to mill your crown. So I always have my assistant go ahead and let's go through the touch process. So when I'm done designing, I can go right away to the milling process and get that ready, have that ready to go. When you're using the Primemill, these are the burrs that you want to have in your armamentarium. Okay, you can get these from Henry Schein. I'm sorry, I do not have the numbers, but you can talk to your Henry Schein rep and they will be happy to provide you with the numbers for this. You can do a mill or grind with your Primemill, but the advantages of using zirconia and milling it is that you can actually mill it very fast. When you do a wet mill, your wet mill will take a little bit longer. So by doing the dry mill, that will be quicker. And then you also don't have to take into consideration the dry phase that your Speedfire will need to go through should you do that wet mill. So dry mill definitely saves time. It is great when you're doing single visit dentistry. In the milling process, you have a couple of different modes. You can do super fast milling, which will mill out a single unit in about 5 minutes, which is pretty amazing. You can do the fast mode, the fast level, which will mill out your single unit probably in 10 to 12 minutes. And the only difference between the mill is exactly how much polishing you actually need to do on that pre-sintered crown. So I actually like to use the fast level because I like all of the detailed anatomy that I've designed into my crowns. And then I'll go ahead and do a quick little pre-center polish before I center that crown. But the differences are actually pretty subtle, I have to say. If you're not using a Primemill and you have an MCXL or MCX, you can do that wet milling, as I mentioned, and the burrs on the left are the burrs that you're going to want to have for that. If you are using an MCXL and you have the capability to do dry milling, meaning that you have a vacuum, these are the burrs that you are going to want to put into that milling unit. Now, if you are going to be planning to do wet milling, one of the things you have to really plan to do is change the water reservoir. So people who do use zirconia and have the MCXL or the MCX, what they will usually do is have a separate water reservoir just for zirconia. Prior to milling the zirconia, you have to flush that milling chamber because of the remnants from other ceramic that you may be milling. So if you're using Emax or if you're using Tessera, those remnants can actually cause defects in your zirconia product if while milling with the water, it gets absorbed into your zirconia crown. So it's very important that you clean out the chamber, you do a little flush. There's a process for actually doing that. And then you put in an absolutely clean water reservoir for your milling, okay? So once you've milled out your crown, you're gonna wanna go ahead and separate the crown from the block. I like to use this zirconia kit. I just feel like it keeps it super simple and I don't want anything too complicated or something that's too aggressive. So yes, while there are these two little fuzzy things that are in the middle, I forget what they're called, but I rarely use those. And so I'm just gonna run through this really quick and explain to you how this works. So on the left side of this block, you have the pre-center polish. So these are the things that I like to use to get out some of the lines that are created when you actually do the milling. And I think that it's better to do that prior to sintering because once it's sintered, getting out those little lines are really, really difficult to remove because that zirconia is just so stinking hard. So that's your pre-center side. Here's your post-center side. So I'll separate the block from the sprue or from the sprue using that carbide burr, right? And so keeping a lot of pressure away from that delicate crown, you want to make sure that you don't puncture it. And that's kind of what it looks like on the right-hand side. If you're lucky, you don't have any kind of flaws to the crown when you're removing it. And then I'll go in with this other burr here. That's a diamond. That's the one that's pictured on the right side with the blue stripe. And very gently go ahead and make that flush to the crown using that burr. And I can smooth it out even more with a red stripe if I feel that I need to do so. And then I go over to these two little pink and beige twists. And this pink twist I will use on the periphery and on the occlusal surface of the crown, staying away from the margins because yes, the margins are super delicate. It's in a pre-sintered state. So I'm doing as much of this polish as I possibly can before I put it into the to the speed fire. And then I go through with the beige twist, and you know, it really makes your post-sintering polish so much easier. So this is definitely something I have been super happy with. Once I get it out of, before you put it into the oven, one quick note, you want to make sure that you take a sable brush, clean out the inside, the intaglio surface, really make sure you dislodge any of that dust that may have accumulated in the intaglio surface, and then give that a really good air blow, making sure that your air line has absolutely no water in it. Blow that dust out of there and make sure that there's no, remnants, free zirconia dust and whatnot on your crown. And then you'll place it with the occlusal side down in your speed fire so that the margins are up, okay? Once I get done with that sintering process and the crown is cool, I will go around the periphery with the green wheel here. This does a fantastic job of finishing the entire periphery. I will then use this green twist to get into some of the occlusal details that I may have created in my crown design, and finish up with the blue twist. And the blue twist is, maybe a maybe. Sometimes I need it to refine some of the polishing on the inside, meaning the occlusal table. And sometimes I'll just go around the periphery with it. But if you want to be real careful, and I don't know if any of you have had an experience like this, but if you over polish zirconia, it gets like marble, and it has this opalescence layer on it. And it's very, not very natural looking, right? If you over polish it. So, with the blue twist, I'm kind of here and there with it, but, the green wheel and the green twist is definitely my post-centering polish tool. I use those really well. Then go in there with the blue, very minimally. And the next thing that I use, and this is the really big money maker here, is to use a stiff bristle brush with the Pearl Surface 2 paste. This stuff is the bomb. It does such a great job of finishing the zirconia surface. I'm in love with it. And it just makes the surface so slick and so smooth. And I really, really, really would recommend this. You can also use it on your ceramic materials as well. So a little bit about the shading. We've kind of talked already about the polishability, which I have been extremely satisfied with. I think that shading on the Zirconia Plus is so spot on. It's really, really nice. You can see here on this left photo, this is a A1 shade with the Zirconia Plus, and my tab there on the left is A1, and then there's your B1 on the right-hand side of it. This is with the photo on the right is demonstrating that shade or coloration with the polarizer. And boy, I just really am very impressed with it. It's not real opaque. It has one of the best colorings that I've ever seen with a 3Y zirconia. So let's talk about the cements. So with this material in particular, I'm picking this material because I need strength. I am probably going to be prepping in an area that I don't have easy access to, like the second or third molars. And, it might be difficult to isolate this area. So to think about trying to do adhesive dentistry in this area where, you could have just a saliva flow, you may have a limited opening, limited access, whatever it is. It's nice to be able to have a cement that is a luting cement that you can use. And Calibra actually has a great line of cements. They have a luting cement that I'm going to discuss in a moment. They have a resin cement that has a self-etching that I'm also going to address later on. And then they also have just a dual cure cement that is really nice and very color stable. And then of course their light curing cement that they use for veneer. So 4 different cements. So I love that about a Calibra. And of course, when you're trying to figure out what kind of cement you want to use, it really depends on your retention and your accessibility and your isolation issues. So this material I do like to use in the second and third molar areas. It's nice to be able to have the Calibra Bio available in case I just don't have the isolation option available. So before I go into the cementation process, I just want to take a minute to talk about the importance of, bonding zirconia or, preparing zirconia. This is really important. So number one is saliva totally contaminates zirconia. It definitely impacts your ability to bond to the zirconia. So you can go ahead and try in your crown. You can check your occlusion. It's key. And then you can go finish up your polish, do a little air abrasion, use your zirconia primer, and now your zirconia is ready to go. When you use a zirconia primer, you have an increased bond strength of over 200%. That's pretty crazy. And wow, 200%. It's interesting. And then in combination with sandblasting, you really create an amazing seal. And so I highly recommend IvoClean, katana cleaner. Those things are great for enhancing your bond. So using the Calibra Bio, you will need to have a titrator. It's a new luting cement that's fairly new on the market. It contains calcium and hydroxyl ions that interact with the phosphate ions in the saliva. The hydroxyapatite forms along the preparation margins and creates a layer that is continuously self-repairing itself should damage occur. It's easy to use. There's no priming. There's low expansion, low shrinkage, and the cleanup is very easy. So let's take a look at how we would do this in a workflow. So you would clean your preparation with pumice or air abrasion and rinse really well with water, dry it. Try in the restoration, make sure that you're happy with all of the margins, the contacts. You can check the occlusion. You're going to go ahead, rinse and dry it. And then you're going to air abrade it. You want to use a 50 micron aluminum at about 30 PSI. You don't need to hold the crown really tight to the abrasion. You can hold it about 1 inch away and that works out great. And then you're going to use your Zirconia cleaner per the manufacturer's instructions. Rinse that thoroughly. When you go back into the room, you're going to prime the tooth. You don't have to prime the tooth. If you use primers, this is great. I will either use HEMA or I'll use a Telio, or there's also just good high percentage of chlorhexidine on the tooth to prepare it for cementation. Go ahead and isolate and dry the tooth. You're going to titrate the capsule for about 8 seconds. You seat the restoration down, make sure you're comfortable with the position, and you're really going to hold that for about 2 minutes, okay? And then you can clean up the excess cement. You can stabilize that for an additional 4 minutes. The final set takes between 6 to 8 minutes after the insertion. And then you're done. So let's talk a little bit about our aesthetic brother to the Zirconia Plus, and that is the CEREC MTL Zirconia. So this is a multi-translucent layered block. You do need to have the 5.2 software in order to use this material. You also need to have the Primemill or the SpeedFire. I guess that's recommended for the fastest workflow. Yes, it will take about 5 minutes in a super fast milling mode. And with the SpeedFire, the crown can be sintered in approximately 18 minutes. It can be finished with polishing or glazing or a combination of both. And you, of course, have cement flexibility in that you can use luting or resin cements. So it has a multi-layered, a multi-transitional layer, high aesthetics. So you can use this in veneers or you can use it for onlays. Of course, it has a high strength. It's 850 megapascals, which is really nice. It has a very efficient workflow, so we like that. And it's time saving and very efficient. So just in a comparison, this is how the gradient is developed. It's very seamless is the word I'm looking for. So it has a very seamless color gradient as opposed to some of the other competitors where you can actually kind of see the layers. And that's what makes this block so desirable. Here are some of the preparation indications. So they're looking at in the posterior regions about 0.7 for reduction. And in the anterior areas, you can get as thin as 0.6. And with a bridge in the anterior area, you can also get about 0.6. So that's very impressive. It's still a very conservative preparation. And you can use this for everything here: crowns, and inlays, onlays, veneers, posterior bridges, anterior bridges. The nice thing about this material is the connector in the anterior zone has to have 9 squared millimeters for the connector size. And the posterior is looking at about 12 squared millimeters. That's really nice. It makes allows for a very aesthetic finish. And here are the burrs that you would be using. Again, this is for dry milling only. You cannot use this for wet milling. And if you're using the MCXL and you have a vacuum so you can do dry milling, these are the burrs that you would use there as well. The finishing process, I'm basically going to be doing the same thing here, separating it with the carbide burr, polishing off the sprue with the diamonds, doing a peripheral polish on the peripheral and occlusal polish with the pink and beige twist. I'll go ahead and center and then go through the green wheel and the green twist. Use the blue twist where I feel that I need a little more detail or a little more refinement, and then finish up everything with the pearl surface frost. It's a beautiful material. Let's talk about a different Calibra cement for a minute. Let's talk about the self-adhesive resin. So, you know, a lot of times your isolation, you want to make sure that everything is nice and dry, but some people have a very rapid salivary flow. So it's nice to be able to have a self-adhesive resin. This allows you to work a little bit quicker and get out of the patient's mouth. So let's take a look at that workflow for a minute. Same thing, you're going to clean off the tooth preparation. You're going to rinse off, try in the restoration, rinse off any debris. Of course, I like to check the occlusion, light checking of the occlusion, make sure that I'm where I want to be so I can go to the lab and put a nice finish on that zirconia. We want to make sure that when you're using zirconia that you have a really fine polish on your surface. Where those lines are actually created from the milling process, trying to remove those is key because that can be very aggressive against the opposing dentition or whatever material you have there. I usually only polish zirconia as opposed to glazing it. And, you know, occasionally I will go ahead and glaze and stain it if I need to, but most of the time I really don't need to. So just depends on your situation. So you take it back to the lab, remove all the saliva, of course, from the inside. And then, so I'll just take my, my steamer and clean out the inside, clean out the outside, and then do a little air abrasion. Again, I probably will steam it after the air abrasion, make sure all of that particle is off, dry it really well, use my cleaner, whether it's Katana cleaner or Iva Clean, and then bring it back into the room, isolate the tooth really well, and then go ahead and you will load the intaglio surface of the restoration. You can hold it in place, of course, make sure you got it exactly where you want it, hold it down. It's really important that there's no movement during the initial phase of delivering that restoration. That's if you're not using a curing light. And you would hold it there for about 6 minutes, making sure that there's no movements, as the movements can really interfere with the bond strings that you're trying to create. Another option would be to load the restoration, firmly place your restoration in place, and light cure, no more than 5 seconds on the surfaces. Again, making sure that your restoration isn't moving until it gets into the gel phase. And then you can remove that gel and you can finish and polish the restoration. Works great. All right, I'm going to switch gears now and talk about lithium disilicate. This is the newest lithium disilicate and it is called CEREC Tessera. This is a great material. It is very aesthetic, very strong, and I really like it. So some of the things that I like about it, of course, is its strength. It's one of the strongest glass ceramic blocks that are offered on the market. It's 32% stronger than the other block, with the biaxial strength being more than 700 megapascals. You only need to have 1 millimeter of reduction, so that means more conservative preps. And it's indicated for crowns, onlays, inlays, and veneers. So in addition to the strength, as I mentioned before, it's highly aesthetic. So it has a very similar component to glass ceramics, actually, when you look at it. The visible light spectrum for ideal, it has a visible light spectrum for ideal translucency, fluorescence, and opalescence. And the material you can use in any aesthetic area. A block allows users to save up to about 44% of total processing time. because you don't need to put it through the crystallization phase. It's already crystallized. The only firing that you need to do is about 4.5 minutes in the speed fire. And I actually like to do that firing before I try it into the patient's mouth. I want to make sure that I don't contaminate it with the patient's saliva. So once I'm done milling it and I clean clean it up and glaze it, I'm going to put that through the speed fire for that quick 5 minutes, and then I'll go in and I'll try it in on my patient. The block is really, really beautiful when it's finished. This is what the prep guidelines look like for Tessera. And you want to take into consideration whether or not you're going to be using adhesive cement or whether you're going to be using a conventional cement. So if you're going to be using a conventional cement, you want to have the material thickness increased to about 1.5 for your reduction. And if you're planning on doing adhesive dentistry or adhesive bonding, you can actually reduce that to 1 millimeter. So the strategy is going to be a grind strategy in the Primemill or in the MCXL. These are the burrs that are required on the left-hand side for your Primemill, should you use your Primemill, or if you have an MCXL, you can use these burrs here. So one of the things that I noticed with Tessera is you definitely want to leave it in its packaging if possible. You know, we're pretty tight with our space, so sometimes we will put our blocks like in one of those organizers so we can just open it up and we look and we know what colors we have without having to pull those boxes out and look and see what, you know, my inventory is. The QR code for this is super important in that it actually contains all of the information from the manufacturer regarding the specifications. So if you take it out of the packaging, sometimes the little print comes off of the block and it separates and then you don't have the QR code. So keep it in the box. And as you can see, it has the QR code on it. So it just makes it a little simpler. So this is what you're going to be looking at as far as processing goes for CEREC Tessera. So when it comes off of the block, you can separate it from the sprue if it didn't come off while milling. I like to use the heatless stone from Meisinger to smooth out the sprue area. And then I want to make sure that I'm protecting the intaglio surface. So these little moldable silicone molds, I guess, can cover the whole intaglio surface so that you can use a spray glaze or you can use a glaze or stains to process that crown. You're going to place it on the honeycomb tray, which will then go into the speed fire. Okay, so once you're done trying in your restoration and you're ready to cement, you can use the 5.5 or the 4.5% hydrofluoric acid gel for 30 seconds. You're going to rinse and dry that and apply a silane, and then you're ready to cement. So let's go to a dual cure cement for this cementation with Calibra Ceram. So same process pretty much. We're going to go ahead and clean the preparation, try in the restoration, confirm the fit, take it back to the lab, rinse it off really well. I don't check the occlusion with this particular ceramic. I want to wait until it's actually cemented before I check the occlusion. One of the benefits of using zirconia is that you can do that. But the other thing about zirconia is when you have to do intraoral adjustments, you have to make sure that you really get that polish really high. Otherwise, it can be pretty aggressive against the opposing dentition. So for the ceramic preparation, as I already mentioned, we're going to go ahead and use the 4.5% hydrofluoric acid for 30 seconds. You're going to rinse that thoroughly, put your silane coupling agent on, go back into the room, isolate the area, dry the tooth really well, use whatever desensitizer or disinfectant process for the prep that you desire. And you're going to apply the Prime and Bond Elect Adhesive. Really make sure that that's super wet on the tooth surface. You can agitate it with your little micro brush. Make sure that you're scrubbing that area really well for about 20 seconds. Dry it with clean air. I don't think I have contaminated air in my rooms, but You're going to use dry air for about 5 seconds, and then you're going to light cure that for 10 seconds. You're going to load the restoration, press down firmly, make sure it doesn't move, and you're going to light cure for about 5 seconds, and then that will put it in that gel phase. And then you can remove that gel from around the margin and wait until it's finally set. And then you can finish and polish the restoration. So just a quick review of the cements that we went through. So we had the self-adhesive resin cement, which has a little quicker workflow, and that you don't need to, keep everything isolated and, put your bonding agent onto the tooth. It already contains those things in the cement. You have the Calibra Ceram, which we did actually go ahead and use the Prime and Bond Elect. And then there's one more that I actually didn't cover because we really didn't have a situation for a veneer, but they also have a completely light cured cement, and that's Calibra veneer. So how do you use, what are you picking, whether it's going to be a luting or whether it's going to be an adhesive cement, really just depends on your prep and what kind of retention that you have available. Short clinical crowns, you're going to want to make sure that you use an adhesive. If you have good longer walls with a good taper to them, then you can go ahead and use a luting cement. And here's just another good reference here. So for your Calibra cements, if you're using glass ceramics, such as like the Vitamark that I had talked about initially, you can use your adhesive cement, the Calibra Ceram. If you have high strength glass ceramics, such as the Tessera, you have a couple of options. You can use Universal or you can use the Ceram. And then of course, for your Zirconia, it's the same thing. So it's got quite a bit of flexibility, and it's all in the Calibra family, so it's really nice. Of course, the veneer is a light cure one. So this is just a little example of what that gel phase would look like, So in the Calibra Ceram, when you go ahead and you seat your restoration and then you give it that quick 5-second cure, this is the gel phase that you want to, that window that's really nice to make the cleanup so incredibly easy. And then last thing I want to mention about the Tessera is looking at the shading of this material. It's really a beautiful material and has quite a bit of flexibility, so therefore great indications. So on the left-hand side here, this is an A2 HT Tessera, and that's just kind of comparing it to your Vita shades. And again, the photo on the right is using a polarizer, so that kind of gives you an idea of the translucency. One of the things that we have found extremely helpful with any material that you have available in your office is to make a custom shade guide. So, we'll take a nice anterior crown like you see here on these bottom photos, and we'll make that same crown in every single shade of that particular material. And that way we really give a good sense of how we're dialing it in. So on this bottom left, that was the pre-op photo of a PFM. We thought that, well, number one, the patient was happy with the color of this tooth. And we said, okay, well, this looks like a good match. And then you can see the seated restoration there. It's pretty much exactly the same. It's really hard to tell the difference. So, and that is it for my my webinar. I sure hope that you guys found this helpful. I do think that there is definitely an indication to have zirconia in your armamentarium as well as a high strength ceramic. These are materials that we use very frequently and have been using very frequently for the last 10 years for sure. And I think that that's something to consider. So I really hope this was helpful for you. And let me know if you have any questions. I'm always available. Thank you.
If you have any outstanding questions, we will try and get back to you. So thank you again, Dr. Thomas, for the great presentation. And thank you to Dentsply for sponsoring this webinar. If anyone has any outstanding questions, please email us at webinars@henryschein.com. And as a thank you for attending, everyone will receive the recording via email in the next week. So thank you all for joining us. Thank you, Dr. Thomas, and we look forward to seeing you on future webinars.